back to my channel. For those of you who do not know me, I am Brianna, aka Dollface PA. If it is your first time here, don't forget to like, comment, subscribe, and turn on post notifications. If you're returning, welcome back. I love you guys. Y'all are the realest. Today we're going to switch up the tempo a little bit. We often discuss the high points and the great things about the physician assistant field, which is obvious because the field is a great field. But today I want to talk about some of the challenges that come with being a PA, specifically an African American female PA. And so, for the majority of time, I would say 95% of the time, my patients are great. But then, you do have patients who, one, don't really understand what a physician assistant is. And I've spoke to that in my previous video. Sometimes there is a challenge when the patients don't see you as a provider. It may be reflected in the way they speak to you, or they'll say things like, "Can you get a real doctor in here?" Or sometimes when I walk in the room, maybe because of my skin color, I've had patients automatically assume that I'm a social worker. Like, despite the fact that I have on scrubs and a stethoscope, I'll walk in the room and I've had patients say, "Oh, you're the social worker. I've been waiting all day to talk to you." And it's just like, no, actually I'm the physician assistant. And sometimes they still don't even know what that means. So they're like, "Oh, so you're a nurse. Like, so when is the doctor coming in?" And so, it's a lot of education and a lot of not taking anything personal, because even after explaining my role, sometimes ad nauseum to some of these patients, they still don't really understand what my role is. They're like, "Oh, okay, so you're just assisting the doctor. So when is the doctor going to come see me?" And I'm just like, oh my goodness. And so that's definitely sometimes a challenge. It can be a challenge for sure. I'm trying to think of a specific instance where I had a rude patient or somebody that was just flat out mean, and how I handled that situation. I've had a few. I've had a few. I mean, regardless of how nice you are, sometimes when people are very stressed out and overwhelmed, they're in the hospital, they don't feel well, they're scared, they're anxious. Sometimes those emotions come out very aggressively and very angrily. And I've had that happen to me several times. You'd be surprised. It usually is coming from the family members and not so much the patient. A lot of times, if it's a patient that the family members feel may not be able to adequately advocate for themselves, such as an older person that may have dementia, or if there's somebody that has some type of cognitive delay or something like that, and they have a parent or a sister or brother speaking on their behalf, those tend to be the family members that can be a little bit more aggressive in their communication style. Sometimes family members don't really fully understand the purpose of an inpatient admission. And so the reason why a patient would be admitted to the hospital is to deal with an acute issue, something that is happening right now that, if not tended to, could be life-threatening. And other chronic issues are to be dealt with on an outpatient basis. And so let me see, your chronic back pain that you have as a result of your degenerative disc disease, that will not be addressed on a hospital admission where you're here for high blood pressure. Like, maybe you have hypertensive emergency and we're dealing with that. We'll make the appropriate referral so that you can see the appropriate outpatient doctors, but that's not the role and purpose of in-hospital admission. And a lot of patients and families do not understand that. They're like, "Well, this is a hospital. Y'all do spine surgeries here. Like, my mom has been needing surgery on her back for 6 months. Why can't y'all just do it while she's here?" And it's like, that's absolutely not how it works. And I can understand why that would be confusing for a lay person, but from an insurance perspective, from a bed availability perspective, there are patients down in the ED that have been waiting for nearly 24 hours that are very sick and need these beds. If it's not something that's urgent and needs to be addressed right now, it will have to be addressed on an outpatient basis. And so, I had I'm trying to think of the craziest thing somebody has ever said to me before. I've been called useless. There was a situation where a patient wanted something that was inappropriate, and so I said no, and he told me I was useless. He told me to get out of his sight. I've been fired before. Like, you're not allowed to come back in here. I don't ever want to see you again. And that's fine. We respect patients' wishes. We just transfer them to another provider team. I think the worst was over the phone. One day I was trying to discharge this lady because she was completely medically stable and her son did not want her to leave the hospital. Some patients really do like being in the hospital, especially the ones that come from nursing homes. They feel that the hospital is cleaner, the food is better. They constantly have somebody tending to their needs because they have the nurse, they have the call bell, whatever they need, they can ring the call bell and somebody is there within moments to see what they need. And so this one particular time, the gentleman wanted his mother to stay in the hospital through the weekend, which we absolutely cannot do. And because she had absolutely no medical indication for an ongoing admission. And I explained that to him and I'm like, the insurance is not even going to pay for this. Like, she has to leave the hospital today. And he cursed me out from A to Z. I don't think I've ever been spoken to like that. And he said some racial things to me. I guess he could tell just by the way I was, just by, I guess, the inflection in my voice that I'm African American. I remember he asked me, he said, "What did you say your name was? Shaniqua?" I said, "No, sir, my name is Brianna." I said, "But this is where the conversation ends." And I hung the phone up. So I very respectfully ended the call because the call was getting belligerent at that point. And it just was like, regardless, there's always a level of professionalism that you have to maintain, but you don't have to let anybody insult you or belittle you or say racially hateful things to you. I mean, nobody has to stand for that. And so I think the best advice I would have for belligerent patients or belligerent family members is just trying not to take it personal, right? Like, you can't take something personal from someone that doesn't know you personally. Like, this person doesn't know me at all. And regardless of why he is so frustrated and why that frustration is being directed towards me, it doesn't matter. Like, that's not for me to figure out. And it's certainly not for me to internalize or feel hurt by the things that he said. I mean, at the end of the day, I'm still human. I was definitely I feel myself getting upset when he's saying these things, but there's a professionalism trumps all. You have to remain professional no matter what. And so I professionally ended the phone call. And I've professionally walked out of patient's room. If a patient is screaming at me or cursing at me or calling me out of my name, I will walk out the room. There's a way to excuse yourself professionally from a situation. And that's really what it comes down to. And so just wanted to share a little piece of that for those of you who are just going into practice, because you will deal with it. And initially it's very off-putting because the first thing that rises up in you is that natural response, which is like, whoa, if you're anything like me, I'm about to pop off. Like, they talking kind of crazy. But you have to have that halt and that stop. Like, wait a minute, I'm still at work. And so that's it. I will see you guys on my next video. Thank you for tuning in. Don't forget to like, comment, and subscribe. Hit me up in the comments. DM me on Twitter or Instagram or email me. Thank you guys for tuning in. Love you. Be safe.